New study finding that people taking Ozempic and Weygovy may be at an increased risk of developing an eye condition that can cause irreversible vision loss. The author saying, however, that more studies are needed to confirm a link. Join us now, Dr. Scott Gottlieb, former FDA commissioner and a CNBC contributor. What do you know about this, doctor? And I assume it's so widely used now, we would know if it was any type of significant percentage as far as a risk. But I mean, even a slight risk of something like that seems like it's something that we need to talk about or think about.
I think that's right, Joe. I think if this was very prevalent, we would see it, given this population of patients now on these drugs. This was a well-done study by a group of physicians at Massachusetts Eye and Ear. They had observed anecdotal reports of this condition, non-arteritic anterior ischemic optic neuropathy, in patients who were on the drug, and then decided to go back and look at the hospital's records to see whether or not there was a correlation between patients who were taking these drugs and a higher incidence of this this really devastating side effect where you get ischemia to the optic nerve and it could cause temporary or permanent blindness. And they did find an increased incidence of the condition in patients who were prescribed the drug either for diabetes or obesity. That doesn't establish a causal relationship. They're going to need to do better studies now going forward, and I think this is going to trigger further investigations. And there's also a randomized study underway by Novo looking at whether or not there's an association between diabetic retinopathy and these drugs. And so that study is probably going to be amended to look for this side effect as well, I would imagine. So there's going to be a lot of investigations going forward. I think regulators are going to get to the bottom of this. I'm sure they're looking at this study. But it's certainly intriguing, and I think it certainly merits further follow-up given the care that these physicians took in doing this retrospective study. It is a little perplexing because these drugs are thought to protect against inflammation and be neuroprotective, and so it's perplexing what the exact mechanism would be. But we do know that vision disturbances are already in the labels of these drugs. When you get rapid correction in metabolic parameters, and particularly blood glucose, that can cause visual changes. And there's also been suggestions that there's a correlation with diabetic retinopathy, which with potentiating that condition as well. So we already knew that there was some association between these drugs and visual disturbance, just not this condition.
Wow. It's a lot to chew over, Dr. Yates. It's, I think, a little bit concerning that, you know, initially it was for diabetes, right? And in the mechanism that we're using here, and there's already something, diabetic retinopathy already. So you can see how there is at least the possibility that something could be going on here. Whether, you know, you mentioned that it seems to be actually a positive for neuroinflammation. So that doesn't make sense. But when you have a drug and you're using one thing, it works really good for another thing, and then all of a sudden everybody's taking it for this other thing when you're not really sure why it's working and the mechanism isn't totally played out. We haven't had it for like 10, 15, 20 years. We don't know. And now we see something like this. I mean, would you caution people that may need to lose 10 or 15 pounds? This might not be the way to do it.
Well, look, these drugs have been around for a long time, the active ingredient, as long as the iPhone, so that gives you a sense of how long these drugs have been on the market. What hasn't been as prevalent is the use of high doses of these drugs for weight loss. Yeah. Typically, when these drugs were used historically, it was for diabetes. So at these much higher doses, I think we're going to find more side effects. Now, again, I think nobody should be taking this drug unless they're properly indicated for it. I've had concerns around some of the compounding that's going on because I think that's more marginal use. When you look at the average BMI of patients who are on the prescription drugs, Novo reported data recently, it's quite high. So I think the patients who are getting the prescription drugs by and large are properly indicated for it because insurance isn't going to cover it otherwise. I think with some of the more marginal utilizations happening is on the compounded drugs. Now, not all of it, but I think more of it's happening there where patients are going online and getting prescriptions, even in instances where they might not have BMIs that probably put them squarely within the target.
We've just talked about BMIs. Talking about it with Sorkin. So what kind of BMIs are you talking about? And I'm not
asking for a friend.
I'm asking for a friend. What kind of BMIs are something over 30? Do you need over 30 to take this, would you say?
Yeah, I think that's the labeled indication, but the average BMI when Nova reported data, and this is a little bit of a while ago, so I suspect maybe it's come down as utilization's expanded, but it was in the high 30s, if I remember correctly.
High 30s.
I would like to see what the average BMI is of some of the telemedicine and the compounded versions. I would suspect it's lower.
Yeah. Yeah. 25 to 30 is sort of, what is that called? That's like, you're not really obese, but you're like getting there, right? 25 to 30. What is 24.9? That's pretty damn good, isn't it? What are you laughing about? That's solid, isn't it? 24.9. I mean, if you're a work in progress, it's working.
Yeah, that's good. I once could quote offhand what the correlation was between height and weight, but I can't anymore.
Okay. But high 30s, whoa, yeah. Push yourself back from the table when you're listening to the band. The band's talking to you, if you get one. We know that one guy did not listen to the band. Doctor, thank you.